Welcome, I'm Martin Sheen. Today, addiction is the #1 healthcare and health cost problem in the United States, with a financial toll of nearly $500 billion each year and a human cost that is immeasurable. The importance of implementing effective treatment and prevention initiatives has never been more important. Policymakers, medical professionals, treatment centers, and drug courts are all joining forces to do just that.
Every 19 minutes, someone overdoses from one of these, with a majority now being prescription drugs. Created to help us, not hurt us, prescription medicines are being misused and abused at an alarming rate. The cause? Experts say it's a combination of reasons, but topping the list is an overall shift in the way we look at and treat prescription medicines that has turned their misusage into such an epidemic.
Of the overdoses with prescription drugs that have occurred, more than 75% of those people who've overdosed admit that they get medications from friends and family, not for prescriptions that were prescribed or medications prescribed specifically for them. So the intent is really part of the problem. People are sharing their medications because they care about people. They don't want them to hurt. They don't want them to be stressed. And in our general population, people believe that prescription drugs are safe because they are prescribed by a practitioner, that there are minimum risks for that, otherwise they wouldn't be prescribed. And that's a fallacy because any drug, no matter how simple, even over the counters, have significant risk.
Dr. Mike O'Neill is no stranger to this issue. As a clinical pharmacist for over 20 years, his expertise is also used within the DEA and the U.S. Attorney's Office, where he serves as a consultant on prescription drug diversion and abuse. Knowing the ins and outs of human behavior as it relates to prescription drug usage, he feels that the drugs aren't the problem, rather the cultures surrounding them.
And in our culture, people want a pill for everything. That is the trend in society today for just about everything. You can't sleep, you take a pill. You can't stay awake, you take a pill. You're hurt, you take a pill. We want immediate cessation of any stress or pain now. And that's not realistic, and it's definitely not healthy. We have got to change the comfort level that people have with prescription medications.
If we're taking them on a daily basis, they're going to be accessible to us on a daily basis, right there, where we could take a glass of water on the top of our kitchen counters. So people coming into our home now have access to prescriptions that they may be abusing. So now that accessibility becomes an issue. So what do we do with those drugs? Do we have to hide them? Do we have to secure them more properly? And I think the answer is yes. We need to secure those drugs.
Additionally, leftover or unused prescriptions account for almost 30% of the overall medications being abused in the United States. Being aware of the following behaviors can dramatically change current cultures and begin to control this epidemic. Sharing drugs is dangerous and illegal. Store prescription medicines out of sight and out of common access areas for children and teenagers. Learn proper disposal methods when throwing away leftover or unused medication. The more informed we are about the medicines we bring into our homes, the greater the chance for proper usage. In fact, studies show that kids who learn about the risks of drugs from their parents are 50% less likely to use them. Parents must also set a good example. In the wrong hands, some of the safest and effective pharmaceuticals on the market can be deadly. The momentum behind this issue is palpable as experts from around the country work to make a difference and save lives.
Advances like these give us hope for a healthier tomorrow. Thank you for joining us. I'm Martin Sheen.